The screen flickers once. Then it goes dark. It is a small event in a busy hospital ward, easily missed. The monitor, which moments before displayed a steady stream of patient data, is now just a blank, black rectangle. There is no alarm, no error message, just an unnerving silence where a machine used to speak. The calm of the room does not break, not yet. But a cold question begins to form in the sudden quiet. A thought that spreads from one mind to the next, like a contagion. What if the tools we trust to save lives simply stop working? What if this is just the beginning? This is not a scene from a movie. It is a real and growing possibility. We have built our modern medical system on a foundation of interconnected technology. From the ambulance racing down the street to the surgical suite deep within a hospital, digital systems are the invisible threads holding everything together. They track vital signs, store patient histories, guide robotic arms, and allow specialists to consult from miles away. We have gained incredible efficiency and precision from this digital transformation. But with every new connection, we have also introduced a new vulnerability, a new door for an unseen enemy to walk through. The fear is not about a dramatic building-wide power outage. It is about something more precise and more insidious. It is the fear of targeted failure. Imagine a single piece of software, one relied upon by thousands of devices, being corrupted. One night, this abstract fear became a concrete reality for Stryker, a massive global company that manufactures medical devices and software. Their products are embedded in hospitals and emergency services worldwide, reaching an estimated 150 million patients every year. Without warning, their systems were breached. Employees logging in found their screens locked, displaying only the logo of a hacking group called Handala. The group, with known links to Iran, claimed the attack was retaliation for a military strike. They declared it the beginning of a new chapter in cyber warfare. A chilling pronouncement that echoed across the healthcare industry. This was not a random act of digital vandalism. It was a targeted political strike. The hackers did not just steal data. They claim to have performed a wiper attack, one of the most destructive forms of cyber warfare. Unlike ransomware, which holds data hostage for a fee, a wiper attack is designed for pure destruction. Its goal is to erase data permanently. Wipe servers, wipe devices, wipe systems, leaving behind a digital wasteland. The attackers claim to have wiped over 200,000 systems and devices and stolen 50 terabytes of critical data. For a company with 56,000 employees and operations in 61 countries, the disruption was immediate and absolute. The invisible infrastructure that ran the company was gone. The attack immediately crippled essential services. One of the systems hit was LifeNet, an IT platform that emergency responders use to transmit patient data from the ambulance to the hospital. In Maryland, EMS services reported the system was non-functional across most of the state. This meant paramedics could no longer send vital information ahead of their arrival. EKG readings, blood pressure, patient history. The seamless flow of information that helps an emergency room prepare for a critical patient was severed. In its place was a sudden, jarring return to slower, less reliable methods. The digital bridge between the field and the hospital had collapsed. This single event exposed the profound interconnectedness of modern healthcare. Stryker is not a hospital, but its products are the eyes, ears, and hands of countless medical professionals. The attack showed that a strike on a third-party vendor can have the same effect as a direct assault on a hospital's own network. The complex web of suppliers, software providers, and device manufacturers creates a vast attack surface. A vulnerability in one company, located thousands of miles away, can lead to a monitor going dark in a local emergency room. The walls of the hospital are no longer a sufficient defense when the threat can arrive through a software update. When a system like LifeNet goes down, the consequences are not loud or dramatic. They are measured in quiet delays and rising confusion. The Stryker incident is not an anomaly. It is a harbinger of a disturbing trend. The healthcare sector is already under relentless assault. In the past year alone, 93% of U.S. healthcare organizations experienced at least one cyber attack. These are not minor incidents. They are happening at an average rate of 43 per organization. In 2024, a record 259 million Americans had their health information compromised. The financial cost is staggering. The average breach costs a healthcare organization nearly $10 million. But the true cost cannot be measured in dollars. It is measured in disrupted patient care. Nearly 1 in 5 healthcare executives say this has already happened due to a cyber attack. What makes the future even more frightening is the evolution of the attacker's tools. Security experts warn, by 2026, AI-enhanced cyber attacks will outpace traditional, human-led defenses. Attackers are shifting from noisy ransomware attacks to fast, quiet data extortion campaigns that can steal sensitive information in minutes, not hours. More chillingly, the rise of politically motivated wiper attacks, like the one used against Stryker, signals a shift from financial gain to ideological destruction. So, we must ask the hard questions. What is the plan for when the digital systems fail? How does a hospital function when its nerve center has been severed? The story of the Stryker attack is a fire drill for a much larger potential catastrophe. It demonstrates how deeply our systems of care are woven together with fragile threads of code, and how easily those threads can be cut. The attack forces us to confront the reality that our reliance on networked technology is our greatest strength and our most profound weakness. We have built a technological marvel, but we have not secured the foundation. The path forward requires a new kind of resilience. Hospitals must not only invest in better cybersecurity defenses, but also in robust, tested plans for operating without them. It means training staff to revert to manual, analog processes at a moment's notice. It means having reliable, offline backups that cannot be erased by a wiper attack. It means creating clear chains of command for who makes the impossible choice to disconnect a whole fleet of devices. It is about preparing for the moment when the screens go black, not as a remote possibility, but as an operational certainty. Imagine a hospital at night. The lights are on and the staff move through the quiet halls. On a desk in the nurse's station, a monitor that displays the heart rhythms for an entire floor flickers, and then goes dark. No sound, no warning. Just a sudden, unnerving absence of information. The quiet in the room grows heavier. The staff look at the blank screen and then at each other. Was that the only one, or was that just the first? This is the new front line of public safety. This is the fear that we must now live with. The knowledge that the complex systems that sustain us can be broken by unseen forces. The next crisis may not arrive with the sound of a siren or the shaking of the ground. It may not be a virus that spreads from person to person. It may be a different kind of contagion, one that travels silently through fiber optic cables and brings our most critical infrastructure to a halt. A cyber attack hits a major medical company. Systems begin to disconnect, screens go dark, and suddenly the question is no longer who was attacked. But what happens if this is only the beginning?